My study is choroidal vascularity index in diabetic macular edema. I have no financial disclosures. So diabetic macular edema is a leading cause for global visual impairment, and its pathogens is evoked by various inflammatory and vascular changes in the posterior segment. Choroid, as we know, is the vascular coat of the posterior segment, and a part of macula is entirely dependent on choroid for its nutrition. Thus comes the importance of choroid in diabetic macular edema. And previous studies have already demonstrated various changes in the choroid, and choroidal vascularity index is now being introduced as a novel marker of the choroidal health, and it is actually a proportion of luminal choroidal area to the total choroidal area. And the aim of our study was to compare the choroidal vascularity index among diabetic retinopathy patients with diabetic macular edema and without diabetic macular edema, and also to find the influence of choroidal vascularity index on various retinal and choroidal OCT biomarkers in diabetic macular edema. We included, ours was a cross-sectional comparative study, and we included 103 treatment-naive cases of diabetic macular edema and 100 treatment-naive cases of diabetic retinopathy without diabetic macular edema. And we excluded all those cases who had a previous history of ocular treatment or any other retinal diseases other than diabetic macular edema or any ocular condition which could impair the choroid. All patients underwent a detailed ophthalmic evaluation, including the EDI OCT imaging, and all of them were classified based on the ETDRS classification to different grades of diabetic retinopathy and different types of macular edema, and the cystoid, spongiform, and the submacular detachment type of diabetic macular edema was included in our study. For calculating the choroidal vascularity index, the EDI OCT images were exported into the ImageAce software, where it was binarized so that the subfoveal white areas represented the stromal choroidal area, and the black areas represented the luminal choroidal area, and a 3000 micrometer central subfoveal area was selected with the polygon tool, and the luminal choroidal area percentage, which is the choroidal vascularity index, was calculated. All the OCT images were also analyzed for the number of retinal and choroidal hyperreflective foci, and also the outer retinal changes like ELM, ellipsoid zone, and RPE disruption, and all these data were statistically analyzed. Now to the results. The choroidal vascularity index among our diabetic macular edema patient was 65.98%, and those without diabetic macular edema was 65.25%, which did not differ significantly. And also, the choroidal vascularity index did not differ significantly among our different types of diabetic macular edema, and also it was not influenced by different grades of diabetic retinopathy. On comparing the number of choroidal and retinal hyperreflective foci with choroidal vascularity index also, no significant association was found. And the outer retinal factors like ellipsoid zone disruption, ELM, and RP disruption was also not influenced by the choroidal vascularity index. Now to the discussion. Chanda Gupta et al. From their study found that the choroidal vascularity index decreases in the presence of diabetic macular edema. But controversing, the Nicolini et al. Found that it increases with the development of diabetic macular edema. And Mirani Kim et al. From their study found the presence of diabetic macular edema did not cause any change in choroidal vascularity index in the diabetic retinopathy patient, and similar finding was also found by us. On studying the different grades of diabetic retinopathy, Mirani Kim et al., Kara et al., and Nicolini et al. Found that the CVI decreases with the progression of diabetic retinopathy, but no such association was found by us. So all these authors propose that the size and density of the choroidal vessels and the choroidal blood flow decreases with the development of diabetic retinopathy and with the progression of disease, but no such association was found by us. This may be because all our patients were diabetic retinopathy patients, and we propose that the choroidal vascular changes will also cause stromal changes like hypoxia and ischemia. So maybe the stromal to luminal area will be a constant in all these diabetic retinopathy patients. On comparing the choroidal vascularity index on different OCT biomarkers, no significant association was found by us, and similar findings were also found by Chanda Gupta et al. So ours was a small population study, and the majority included non-proliferative diabetic retinopathy, and it was a cross-sectional study in which only the images and the data in the initial visit was analyzed. So a change in the CVI with the development of diabetic retinopathy or its progression or with the development of diabetic macular edema could not be proposed. So a longitudinal study which analyzes the pre-diabetic retinopathy changes in the choroid and retina will give better information. And choroid, being a highly vascular structure, will be definitely be influenced by vascular disease like diabetic retinopathy. So higher population study will give better results and inferences. So to conclude, the severity of diabetic retinopathy is not influencing the choroidal vascularity index, and choroidal vascularity index is not found to influence the presence of diabetic macular edema or the type of diabetic macular edema, nor is it found to affect the outer retinal and choroidal changes in diabetic retinopathy and diabetic macular edema. These are my references. Thank you.
Good presentation. Thing is, this index which you spoke about, can you quantify it as well? This index that you spoke about, this choroidal index that you spoke.
Yeah,
Can you quantify it as mild, moderate, severe based on the values?
No, sir. We didn't quantify because all our data were within 60 to 70%.
Okay.
No previous studies haven't quantified it like that.
So you didn't quantify it.
No, sir.
And how is this going to help in your decision making for treatment compared to OCT versus this particular index that you have got? How is it going to help in your treatment?
Maybe we could predict the development of, based on the changes, we could predict the progression of the disease, and likewise measures could be taken. So we could control the disease if we get better insights into the involvement of choroid in the disease.
No, because you said there are mixed reports between diabetic retinopathy and this. So
Yeah,
this was
study population is also
Yeah.
differing in these studies. Okay. Thank you.